Yeah, that's a great question. So ADHD is a disorder characterized by hyperactivity and or attention issues. So this could show up for adults in a lot of ways. You can have problems finishing tasks. You can have problems staying organized, impulsive behaviors such as interrupting others during speech. And you'll often find in one or more areas of your life, these difficulties executing tasks can lead to dysfunctional problems with your quality of life. I'm Gabriela Zambrano Hill. I'm a family medicine physician. I work at Houston Methodist PCG Mont Bellevue. That's also a very good question. So a few years ago, ADHD was actually very underdiagnosed in females, and it was thought that it was perhaps possibly even only a male-associated disorder. But it's now come to light over the years that what is actually happening is that females tend to present more with the inattentive type of presentation, whereas parents, physicians, teachers are really looking more for the hyperactive, impulsive type of presentation. So it's important to be aware of both types so you can be on the lookout for them. So getting diagnosed with ADHD, you could be diagnosed in childhood, which makes things a little simpler. But as an adult with ADHD, the very first step is to undergo an evaluation to rule out any other medical causes that could be contributing to the same symptoms. After that, you would do a comprehensive evaluation of your functionality, your relationships. This is often taken in the form of questionnaires of yourself and other people in your life. And if there's still some clarification needed as to your diagnosis, you can even undergo neuropsychological testing, specifically trained professionals. So people who can diagnose ADHD, qualified medical professionals, physicians, especially neurologists, primary care providers, pediatricians, psychiatrists. But you can also have specially trained psychologists, nurse practitioners, other providers, as long as they have the qualifications to do the necessary testing for a diagnosis. Okay, so there are chiefly three categories of ADHD. You have the hyperactive impulsive presentation, you can have the inattentive type presentation, and then you can have a combination presentation, which shares features of the two previously mentioned. So ADHD and ADD are in some ways the same thing, as ADD is no longer considered a diagnosis. ADD is rather considered the inattentive subtype of ADHD. ADHD and depression can be correlated. That is part of the reason it is so important to undergo a thorough medical evaluation to make sure that we're not mistaking ADHD for something else that could be having the same consequences on your quality of life. ADHD and anxiety are absolutely correlated. I've had lots of patients come in thinking they have one, and it turns out it's most likely the other, and then we're able to treat them appropriately. So again, just a thorough evaluation at the beginning is the best first step.